the most commonly misunderstood condition on the skin is melasma. Melasma is also called chai in Hindi or bongu ya mongu in Kannada, and this is characterized by a pigment patch in and around the cheek. It can be on the nose, the forehead, etc. So there is a lot of myth and understanding which is not clear about melasma. Hello, I'm Dr. Tina Ramachandar. I'm a consultant dermatologist with a special interest in dermatosurgery and lasers, and I practice in Sakar Nagar, Bangalore. So let's understand more about melasma. So now what is melasma? Melasma is one of the hyperpigmentary conditions in skin, and here you have sudden development of light brownish color which starts to appear on the cheeks, the nose, and people generally associate terms like hyperpigmentation, pigmentation to it, and there is a sense of fear associated with melasma because people feel it indicates the onset of stress, etc. Now, why a melasma happens? It's exactly not known in allopathy, but there are certain triggers like exposure to sun, pregnancy, any hormonal change, etc. can lead to melasma. Now, what is the cure for melasma? Since there is no particular reason for melasma, we do not have something like a substantial cure. So when you go to a dermatologist and you take treatment, always remember that melasma cannot be cured, but it can be controlled. So you have several varieties of melasma. The superficial variety, which is on the superficial part of the skin, usually tends to go, but the deeper part will only reduce in color. So when you finish the course with your doctor, it's very important that you maintain it. So if you do all expensive procedures and still go out in the sun, it is coming back. So learn how you will have to maintain this condition for a longer period. So controversial part about melasma is the usage of steroids. So traditionally steroids, and we say Kligman regimen, that is hydroquinone, tretinoin and a steroid usage was used. But in nowadays time, steroid is strictly not advised for melasma, and this in fact will worsen your skin. So melasma requires a gentle therapy of a good sun protection factor, even if you are somebody who's indoors or you're in front of the screen most of the time. So blue light, infrared light protection is important. The quantity is very important. So half a teaspoon for the face, for instance, is the right quantity. If you apply anything lesser, you're not getting the protection. Remember, any tinted makeup or a foundation is clinically known to protect you from melasma. So application of sunscreen and then your foundation or the tinted makeup can protect you. Next, the night medications usually include things which reduce the skin intensity of the pigment, like a tyrosinase inhibitor, we say, for instance. So all of these things will reduce the amount of brown cells in the skin. So consistent everyday application of products which contain hydroquinone, licorice, arbutin, tranexamic acid, azelaic acid, these are all great molecules to reduce and maintain your melasma. So weekly once application of a stronger product which contains retinol or tretinoin, which is again guided to you by your dermatologist according to your skin type, is a wonderful way to maintain, reduce and control melasma. Now we go to the procedures. Ideally, melasma procedures are not advised as much because this is an unpredictable disease. There are people who can have worser melasma after doing procedures if care is not taken properly. But certain procedures like a chemical peel of glycolic acid, retinoic acid, or usage of lasers, which are Q-switch lasers, and peels which are deeper, can help reduce, but rebound effect and reappearance is a common thing. So get clarity before you opt for anything like this. So melasma can be challenging, but with the right approach, it can be controlled quite effectively. So don't forget to hit the subscribe button to know more about skincare tips and tricks.